My name is Catherine Wimberly. My dysphagia research topic was feeding in the NICU. What is feeding in the NICU? Stanford Children's Hospital defines it as feeding babies in the NICU is quite different from feeding healthy babies. When babies are sick or premature, they are often not well enough to breastfeed or take a bottle. Premature babies may not be able to suck effectively, or their GI tracts may not be mature enough to digest feedings. Babies who have unstable health are often unable to take regular feedings. Babies with umbilical catheters and those who need help breathing, such as with a mechanical ventilator, may not be able to feed. This is because of the risk of problems such as aspiration. So what is our SLP role in feeding babies in the NICU? Well, ASHA has some standards of competency. There are 12 main competence for SLPs in the NICU, and each one has a subcategory of skills. I'm just going to list the 12 main ones, which is identification of infants at risk for and with existing developmental, communication, cognition, feeding, and swallowing problems, conduct clinical assessment of the infant and family for communication, cognition, feeding, and swallowing problems, including neurodevelopment assessments, conduct instrumental evaluation of the infant for feeding and swallowing problems, provide support and intervention treatment for the infant's communication, cognition, feeding, and swallowing problems, provide education, counseling, and support to families, other caregivers, and staff regarding preferred practices in the NICU to support current and future communication, cognition, feeding, and swallowing skills, collaborate with other team members regarding management decisions for care of the infant and the family, maintain quality control and risk management programs, provide discharge, transition, planning and follow-up care, educate and supervise SLPs, including clinical fellows and students in training, provide public education and advocacy for serving infants and families in the NICU, and conduct basic and clinical research in fetal and neonatal development and function and effectiveness of treatments. Next big thing that was talked about when looking at feeding in the NICU was the interdisciplinary team and how important collaboration is between SLPs, OTs, and PTs. So, the best outcome in the NICU is to have all three on the same page. So, PTs work on gross motor control and positioning, and OTs work on sensory integration and teaching families and staff how to help infants to participate in functional activities like soothing. The OTs also work on fine motor and visual motor skills. The NICU has a proactive approach opposed to a wait-and-see approach. Open communication is the key for an interdisciplinary team to work well. They often meet to discuss each client's goals and main concerns with multiple meetings weekly and monthly. Now, with my article findings, the first one was a research study on speech genes, and you could detect it in the saliva if they could predict feeding outcomes in premature newborns. They did a study with 51 premature infants, and 4 genes were tested, but only 2 were detected consistently. It says more research is needed and a larger sample size to fully understand the expression patterns of speech-language genes and to accurately predict oral feeding readiness. The next one was a qualitative cross-sectional study to understand the experience of 15 families hospitalized in a tertiary neonatal intensive care unit, and they compared it with Finland and the U.S. There were 8 families in Finland and 7 in the U.S. It's found there was a difference in culture with both locations and that over how they feed their children. In Finland, breastfeeding was seen as one method to be close to an infant, while in the U.S., breastfeeding is more related to the health of the baby. So care culture plays a large role in framing all infant caring activities, including lactation and feeding infants. The third article was 218 extremely low gestational age infants were compared for neonatal morbidities feeding milestones, and Bailey-III scores at 8 and 20 months. A multiple regression analysis was adjusted for the effect of risk factors on feeding disorders and neurodevelopment outcome. There were 218 extremely low gestational age infants, and they found that 27% of infants had feeding disorders, and that oral feeds was the only predictor of feeding disorders. There was a linear regression for peds at start of oral feeds and was the only predictor in motor experience. They did not predict outcomes at 20 months. So it found that surviving extremely low gestational age infants with FDs in the NICU has significantly worse cognitive and motor outcomes in the first year of life. Okay, and then another thing I searched was when doing my article research, there was other articles that didn't do a study, and two in particular that I really liked. One was talking about the use of thickeners in the NICU and it being a long-term solution and having negative effects on infants' oral and swallowing development. And Catherine Shaker wrote a response to that article and said that those assumptions made by using thickeners too much in the NICU were incorrect, and that's not how she practices or how many people across the country practice. She stated that thickeners viewed as a long-term solution is not consistent with the best practice in the NICU. She also went on to say that thickeners should be used as a last resort in the NICU after changing the feeding position, slowing nipple flow rate, and using contingent co-regulated pacing to support the swallow-breath interface and assure timely and sufficient breaths. Thickening is rarely used in the NICU today unless a specific infant needs it or it's used as a short-term intervention. To make the decision to put an infant on thickened liquids is discussed greatly with the interdisciplinary team. She said if the interdisciplinary team indicates a thickened liquid is needed, there is contingent use of interventions to minimize the risk, support both oral motor learning, and avoid maladaptations that may otherwise result. So it was a very cool article that she wrote for a follow-up. Like, she wrote her response. I thought this was very interesting, and I hope you learned something as well.